Hello, this is Dr. Himanshu Trivedi. This is our third week. First week we had discussed about good health. Second week we discussed about hypertension. Today we are starting the third week. Today I'm first going to give you the summary of what we had done last week. We had defined hypertension. Hypertension means blood pressure above normal. Whenever the blood pressure systolic is greater than 140 and diastolic greater than 90, we call it high blood pressure. As I had mentioned before, it is a silent killer. Means that it does not give any signs and symptoms. It is only when you go into a doctor's office and as a routine checkup he checks your pressure, and that's when a person gets surprised that they have been suffering from high blood pressure. Usually we had also discussed about the risk factors. Age, usually people with older age have it, people with a family history, obesity, stress, smoking, and high salt intake. We had also discussed about some signs and symptoms that patient usually is asymptomatic, means there are no symptoms. But in some cases, people do get headache, dizziness, blurring of vision, chest pain, faintness. So these are some common ones. But as I again repeat, that mostly it comes without any signs and symptoms. That's why it is a good idea to get your blood pressure checked on a regular basis. Why one should treat hypertension? If the pressure does not remain under good control, it will affect your eyes, it will affect your heart, it will affect your kidney. Basically, it affects the blood vessels. So, as I have said before, blood vessels are everywhere in the body. So it affects almost the whole body. So it's a challenge for the patient as well as the doctor to get that blood pressure under good control. About the treatment or prevention part, we had also discussed that a healthy diet which is less in salt, regular exercise with the loss of weight, and lifestyle changes like avoiding stress, having a good sleep, not to smoke, not to take too much of alcohol. So in short, we had discussed about high blood pressure in the last week. This is a short summary of high blood pressure. From next day, we'll be discussing about diabetes mellitus. Thank you.